Local scientists are working hard to develop new tests that may reduce the occurrence of a disease known as valley fever at the Translational Genomics Research Institute, also known as TGEN.
Cutting-edge technology is being used to understand outbreaks and track where the disease has spread. Amber Neat has the story.
Valley fever is a respiratory illness caused by inhaling spores of fungus. The illness is most common in those ages 40 to 60. Symptoms include coughing, chest pain, chills, and lumps or rashes on the skin. Often patients go to the doctor 6 or 7 times before being diagnosed properly.
Most serious patients, we need to find out whether or not they have valley fever as soon as possible so that they can get started on antifungal therapies. So again, this is giving more information for the doctors to better understand how to treat and manage their patients.
Here at TGEN North, scientists are developing a test to help patients get results faster.
One of the great findings is that we were starting to see some biomarkers in the valley fever genome that would be really useful for developing a new diagnostic test.
In other words, the more we know about valley fever, the more we are able to treat and eventually prevent it, leading Dr. Engelthaler and his team to develop a new test.
So patients will essentially have to cough up a respiratory sample, and then we can extract the DNA out of that sample and then run it essentially on almost a plug-and-play test cartridge with this new DXNA version of the test.
And the best part, the test produces results in about an hour and a half.
And so this is something we've been working on for the past several years, which is how do we really turn this new finding into something that doctors can use in the hospitals and in their doctors' offices to find valley fever patients and to better treat them.
Amber Neat, NAZ Today.
TGEN scientists continue to work on the treatment and prevention of valley fever right in Flagstaff's backyard.